A grim picture this evening of how nurses have been buckling under pressure as a third wave of COVID-19 cripples the island. President of the Nurses Association of Jamaica, Patsy Edwards-Henry, said some nurses have had to work 24-hour shifts 7 days of the week as many of their colleagues have been out with the virus. Kalisha Williams has our story.
The COVID-19 numbers are rising. Hospitals are full. And like other healthcare workers, the island's nurses are overwhelmed.
To think that we thought we were getting a little break, and now it has just started again.
Speaking on Power 106's current affair program, The Morning Agenda, on Thursday, President of the Nurses Association of Jamaica, Patsy Edwards-Henry, said nurses have had to be working double and triple shifts as COVID cases climb.
It is the same nurse who works in the hospital, who works in the health center and community, that is at the arena on Friday, at the arena on Saturday when she's off, at the arena Sunday when she's off, at the arena Monday when she's supposed to be off. She's at her clinic and the arena Tuesday, Wednesday and Thursday, and then to go again for the next weekend.
A situation, she said, is far worse in Type C facilities like the Port Antonio Hospital in Portland. Mrs. Edwards-Henry explained that the hospital, which was not meant to admit any COVID patients, now has 26. She pointed to one instance where the nursing director had to transform her own office into a holding area for COVID patients.
They had to retrofit a whole area, and they put 15 beds in that area.
In her office?
In her office was one of the spaces, yes. Right. She, the SMO, and a few other of the admin staff, they had to move out of their offices.
And on top of that, a significant number of nurses have been out with COVID-19, which means more pressure on the available staff.
I do know that I have about 3 out in Maypen. There was 1, I think, at university, and 2 from KPH. Those were the persons who I had spoken to. Mm-hmm. But when I heard that, because I was saying to myself, okay, nurses are sort of out of the woods. When I heard that, I'm like, I have to start calling around now to find out what's happening with my nurses.
Now, the NAJ is hoping that there will be a greater take-up of the COVID-19 vaccine to help reduce the burden on the health system. Kalisha Williams, TVJ News.